Hello. Today I'm going to talk about alcoholism, the chapter 31. And I'm going to read some of this off because I can't recite this off the top of my head. So alcoholism affects about 10% of men and 20% of women. About 2,000 people each year under the age of 21 die where underage drinking is involved. About 85,000 deaths per year in the United States from alcohol. Economic cost estimated at $185 billion per year. There used to be a lot of talk about risky drinking and how many drinks are allowable. And I think it really had to do with one drink a day, which was 12 ounces of beer or 5 ounces of wine or 1.5 ounces of 80 proof spirits was considered to be the definition for one drink. And then you were allowed 2 drinks a day if you were a man under age 65. Over age 65, you were allowed 1 drink a day, and women were allowed 1 drink a day. But the latest information indicates that any alcohol at all is deleterious and can cause multiple cancers at different sites, GI cancers and other cancers. It's published in the U.S. Surgeon General's Advisory in 2025. So the idea of, well, I'm going to drink 1 glass of red wine a day, it's supposed to be healthy for your heart and all of that, has really gone by the wayside. I saw in my practice many alcoholic patients through the years, and most of them didn't give up the alcohol. There were a few, though, that did, and it was life-saving in a few cases. And so it's always worthwhile, I thought, in my mind, to try and get the patient to stop drinking, especially if they were suffering consequences or were heavy drinkers. Although I admit, I think many times we don't really know who's an alcoholic when they come into the office. They don't come out oftentimes and tell us. I can remember one patient where she was having problems, kept coming to the emergency room, kept getting admitted. Unusual symptoms really didn't add up. Scans were okay. And then one day in the emergency room when I saw her, I smelled alcohol on her breath. And if I hadn't done that, I really I would have never known what the problem was. And it turned out she had plenty of reasons to be depressed. She lost her husband. But she had her pets, and she really focused on that. And I developed a good physician relationship with her and her family, and I saw other members of her family. She quit drinking, and she did good. She did well. So, I always was taken aback whenever I smelled alcohol because most of the time I had no idea the patient was a drinker. When I wrote this, I'll also say the consequences of alcohol can reach many families. My wife's extended family, my own extended family, we were touched by alcohol, and in a bad way, and there were a lot of consequences from that. And many of those consequences don't leave you over time, stick with you. It can cause death, disability, alienation from family and friends, unemployment, you can get fired from your job. All sorts of consequences can occur that are negative. When I wrote this chapter, I said that my latest patient was a young woman who turned yellow 2 years ago. Well, That would have been 2 years before I wrote the chapter, and that would have been a long time ago. But anyway, in practice, there was a young woman, and she had turned yellow or developed jaundice with liver disease. And she had some recovery. So some patients will have what's called alcoholic hepatitis on top of chronic liver disease, and or just alcoholic hepatitis. Most of them have underlying cirrhosis, and so they can recover some function of the liver and get a little bit better and improve. And she did, and I told her if she went back to drinking, it would kill her. And, we tell a number of patients that sort of thing. And sure enough, she went back to drinking and it killed her. And I felt sorry for her son. She had a young son who survived her, and he and I had a relationship, not just one of those relationships that you get with people that you become close to. And it was very sad. I had another patient who had a pancreas problem, pancreatic bleeding, hemosuchus pancreatitis, or pancreaticus, where you get these pseudocysts, and you get this erosion of vessels in the pancreas, and you have this intermittent arterial bleeding that is coming down the pancreatic duct into the intestinal tract. And it was very difficult to make a diagnosis. Her diagnosis was made, the bleeding was stopped. She said she wasn't going to be drinking anymore, and then this was in Texas. She didn't live in town. I was in San Antonio, and she developed the problem again, came back in, sweared up and down she wasn't drinking anymore. And her husband would bring her in the back of the pickup truck, as I recall. But anyway, at one point she did die, and her husband later told me that she never quit drinking. It was another sad case. I can still remember her name. I'd see patients in the hospital that had no family, nobody ever check on them. It's just tragic. When I saw these patients, I would try to figure out where they were mentally with the problem, because there are various steps in alcoholism and trying to beat it. And number one step was to accept that you have the problem, that it is a problem. And a lot of people were never there at that point. That was a very important step for them, and many of them would never accept that they had a problem, and those were more difficult. And then there were some that just would tell you straight out they weren't going to quit drinking, and they would go on and suffer consequences and die. And many people think they can control their bleeding, but the alcoholic patient is not really able to do that. I think the best thing for them is to avoid alcohol altogether. And they need a support group. So your classic support group was Alcoholics Anonymous, the 12-step program. There was a book that I was introduced to by my partner in San Antonio called The Sober Truth by Dodds and Dodds. And they pointed out that some patients are better treated with a psychoanalytic approach, tend to focus on the cause of the problem and self-empowerment rather than turning everything over to a higher power. So I think it may depend on the patient's personality, their belief system, their religion, and so forth. Now, there are a number of medications that have been used to help people with alcohol use disorder. The old one is antabuse. That's been around a long time. Acamprosate and naltrexone. But they work best if the patient is in a rehabilitation program. Physicians are really pressed for time. They really feel like they need to move through patients and get through their day and get things done quickly. And so many of them have just given up on the idea of talking to patients about alcohol problems or talking to them about smoking, and they think somebody else is going to do this for them, but it really is not the same if somebody else takes this on, and most of the time nobody else is going to take this on. Many times I would ask patients to focus on why they were living, and that if they had family, and most of the time it came down to that. They have to do it for themselves and their family. I also tell people that they wouldn't want their family to think that they were defeated by alcohol. It really helps, I think, to follow them along, take an interest in their case, and ask them how they're doing with that alcohol issue, and that can be very important. There is another medication that has been used, an old medication called baclofen. That one can sometimes be very helpful as well. And I saw some success with that. And there's a senior liver doctor who really used a lot of that, and thought that was very helpful. You have to keep in mind a lot of people are not going to go to rehabilitation, and they may have other drug problems with the alcoholism. It may not just be alcohol. That can be certainly a very devastating problem. And I think I should also mention that the bailout for liver disease and liver failure is liver transplant, but it's generally not offered to alcoholic patients unless they've been abstinent for about 6 months. Now, there are exceptions that are made, and I remember that we made one that I can recall on a patient that I think was successful, although I don't know the whole long-term story on it. But she had a very supportive husband, and she had not been drinking for a while. There is a blood test that can determine if the patient has been drinking recently, and not just an alcohol blood level, because those clear out fairly quickly. But there is one, and we would use that, and so would the transplant centers. And that can be a very important piece of information. So with that, I'm going to go ahead and close on alcoholism. Thank you.